What St. Mary's really means to me is almost a haven or a sanctuary, some place I can go and know and be confident that I will receive help and hope and caring.
If the particular nursing staff that was here that morning, and the physicians, and the equipment that was available, if all of that wasn't here that morning, I would not have made it. That's what my physicians have told me. So obviously I feel very, very fortunate and thankful.
Really means a special friend or a special place.
I really feel that I owe my life to this hospital and the staff here.
From the countless experiences and heartfelt stories told, it is not difficult to see and understand the difference, the impact St. Mary's has had on the people we have cared for over the years. However, we sometimes overlook where the difference lies. The impact St. Mary's has had on those we serve lies in the caring touch, the friendly smiles, and the warm hearts of our people. The difference lies in the tireless efforts of everyone at St. Mary's who have made the undaunted commitment to care for those in our community. It's quite an accomplishment and an honor to have provided our community with an unparalleled medical institution for the past 125 years. From a modest 100-room facility with 7 doctors in 1872, it has been the dedication of the people of the Daughters of Charity that brings us to where we are today.
Our mission to the poor says that everyone has the right to health care. Health care is not a privilege in this country, it is a right. And serving the destitute poor is really very part and parcel to what our founding fathers talked about when they talked about our obligation to care for the common good. Only our society doesn't have this sense that we have that obligation anymore. Our mission says we do. And so people come to us for care, and they're cared for whether or not they have wherewithal to pay for that care. As I see the efforts of St. Mary's in the community and our ability to embrace the poor, whether they be materially poor or the elderly or the tiniest little baby who's trying to live, our ability to really be Christ for the poor is something that each day I take great pride in for our medical center.
The vision and spirit of the Daughters of Charity have been relentlessly carried out throughout the years, as it is today, penning countless accounts of heartfelt memories.
I came to St. Mary's in October of '95, having had a massive heart attack at my office, and the ambulance brought me to St. Mary's emergency room, and I was admitted to the heart cath lab and had a couple heart catheterizations that morning, and had another heart attack here at the hospital. Actually, according to my cardiology nurses, I died twice while I was here at St. Mary's that day. All of the physicians and nurses and equipment was available here that day, or I wouldn't be alive today. I literally owe my life to St. Mary's Hospital.
With the help of St. Mary's, I've been able to raise 10 children and help raise 17 grandchildren. I can recall many incidences, but the one that really stands out in my mind is when our daughter Andrea was diagnosed with MS. And everyone in the hospital she was admitted that day, and everyone in the hospital, nurses, doctors, technicians, came in to talk to her and to talk to us. And I'll always be grateful for that day.
I've been a volunteer at St. Mary's for over 40 years. I've put in 9,700 hours. You talk with people and you feel like you're doing something to help somebody. And you not only help the hospital, you help the patient too. It's a nice thing to work in a place where you have people that are sick and you help them.
Dateline, 1872. The first St. Mary's opens on Feast of St. Vincent de Paul to care for the sick and poor in Evansville, a town of 30,000. Hospital fees were $5 a week, and those unable to pay were admitted cheerfully and nursed expertly as charity patients. 1893. As reported by the press, fully 10,000 came to see what was heralded as one of the finest hospitals in the West. A newer, larger St. Mary's was built at First and Columbia. 1949. St. Mary's adopts the thesis of one of its visionaries, Sister Justina Morgan. Better patient care. Put the emphasis on treating patients as individuals and not as cases.
On March 10, 1956, Operation Good Neighbor took place. This was the move of the hospital from First Avenue location to Washington Avenue. We had lots of reporters, lots of cameras kept going off in our faces, and lots of microphones asking questions, which was fine. And yet we still went ahead and took care of the patients. I stayed at the old hospital and sent all the mothers and babies off of the old unit, and then some of the other staff was here to receive them. But they said the streets were lined with people as they through the route there to watch this move take place.
I was the last baby born before Operation Good Neighbor. I can remember my mom saying that they weren't accepting patients at the hospital on First Avenue anymore on Friday, and you know, they kept saying, no, you can't, and she said, yes, but I am. And so they finally let her in, and I guess she checked in Friday morning, and I was born at 3 in the afternoon. And then 16 hours later, they loaded us all up on a truck and moved us to the Washington Avenue Hospital. There's a woman at church that knows I was the last baby born at Old St. Mary's Hospital, and or at the hospital on First Avenue, and so whenever she sees me, she calls me the famous baby.
Dateline, 1957. For the first time, fathers were allowed to witness the birth of their child, as St. Mary's introduces the first family-centered maternity care.
It changed because you can't really call anything family-centered without you have the family together. By family, I mean the baby who's coming or has come, and mom and dad. The story of what we were trying to do there grew. It went everywhere, you know, because there was no such thing. And nurses from other hospitals would call and say, could they come from, they could have been in Michigan or New York or wherever. And they call and want to know if they could come and spend a week and see what we were doing. It really was something that took off.
It was obvious to us that where you have a residency program, it upgrades the entire staff. Everyone on the medical staff benefits. You have people that challenge you, the students ask questions, they bring new things in from medical school, and so when the opportunity existed for us to develop a residency program, we jumped at it. Virtually every family doctor on the staff now has been trained in family medicine through a family practice program, and most of them have been trained by us, by the people right here at St. Mary's. And I think it's going to give us a continuous supply of doctors, and it has, and it will in the future.
1991. The new American hospital concept was adopted to identify the uncommon leader. This concept calls for a transformation in perspective, bringing forth new ideas and a shared sense of responsibility from every department and from every employee. St. Mary's partners in excellence. These datelines are just a few examples of the numerous innovations the partners have implemented over the years. Today, St. Mary's has grown to be more than a medical center. It is a system of health care services with a staff of over 2,500 dedicated professionals, people who care.
People who work here, in many cases, only work here because they believe in the values of the place, the mission of the daughters. They don't work here just because it's a hospital. They work here because they believe that it's different than other places. The foundation, the mission, the values of St. Mary's never change. They have been just what they are now for 125 years. Now, we provide different procedures than we used to provide. We do it in a different way than we used to do it. We have different technicians and doctors. We have different buildings. But people who came in here 100 years ago would probably be familiar with the spirit of this place just the way it is today.
Each year since 1994, St. Mary's has been recognized as one of the top 100 hospitals in America. This notable designation places St. Mary's in the top 2.5% of 4,000 hospitals in the country. Containing healthcare costs, reducing hospital charges and the average length of stay, and also reducing mortality rates. Every member of the St. Mary's team should stand tall and proud of these accomplishments. Because we have made a difference in the families and individuals we have cared for, and the lives we've saved.
The people who work at St. Mary's really are St. Mary's. You cannot define St. Mary's in terms of bricks and mortars. It's really the people who work here. We call them partners. They have been St. Mary's for 125 years. They will continue to be St. Mary's into the future. There's a sense of heritage that really is part of everybody who works here. And you take that heritage with you when you do your job every day, but it's also the basis for which you do the work in the future as well. It's the basis by which you develop plans, develop scenarios, healthcare scenarios that are going to continue to keep St. Mary's in the forefront of healthcare into the future.
The healing hand of St. Mary's does indeed extend into the future, and to everyone.
I think the difference at St. Mary's is that we are a mission-driven organization, that the mission is not something that we just put on paper, but we live that out every day. It is the critical difference in this organization. It is what guides our actions. It's what guides our strategic plans. What we're going to do in the future is based around how does it fit our mission.
St. Mary's is proud to share these core values with the Daughters of Charity National Health System, which reflect our health ministry and those we serve. With the copious changes that have occurred in the past 125 years, expansion of our facilities, increasing regulations, and advances in medical technology, our mission has and always will remain the same: to serve the community, regardless of ability to pay. This mission simply cannot be carried through by bricks and mortar, and not by medical instrumentation. The mission and caring touch of St. Mary's, day in and day out, lies in the hands of our people. People who make a difference.